I have this pleasant job of introducing the Indian National Association Study of Liver Guideline for Management of Hepatitis C virus infection in India, which has been published in Journal of Clinical and Experimental Hepatology, the official journal of Indian National Association Study of Liver. We are all aware that global burden of hepatitis C virus is considerable. About 150 to 170 million people are chronically infected with hepatitis C virus infection in the world. Untreated hepatitis C virus infection leads to cirrhosis, liver cancer, and end-stage liver failure leading to mortality. About 1/3 of patients with cirrhosis and liver cancer globally are because of hepatitis C virus infection, and it has been estimated approximately 5 lakh people die because of hepatitis C virus infection in a year globally. Now, India, as well as other middle and low socioeconomic countries, do have large burden of hepatitis C virus infections. About 80% of global burden of HCV belong to this country like India, Africa, East Asia, Middle East, and therefore the management of hepatitis C virus infection as well as prevention of hepatitis C virus infection in this country assumes public health importance. Countries like India need dual approach of prevention as well as treatment of existing chronically infected hepatitis C virus infection. Till date, the standard of care for hepatitis C virus infection was pegylated interferon with ribavirin, a combination therapy, with which about half of the patients with chronically infected hepatitis C virus infection could be eradicated effectively. The cure of virus or eradication of virus was possible in genotype 1 in about 45 to 50% of patients, and in genotype 3, which is prevalent in India, in about 70-75% of the patients. Now, there had been drugs which has been developed to inhibit replication of hepatitis C virus infection directly, which are called directly acting antiviral agents. Particularly, in December 2013, FDA in USA cleared 2 direct antiviral agents in the name of sofosbuvir and cimapravir. With this direct antiviral agents, the viral cure today is possible in 90 to 95% of patients across all genotypes. Even consideration of a single pill combining multiple therapy across the disease spectrum of hepatitis C virus has been established to be quite effective. However, there is a rider. The rider is these drugs are extremely expensive. These drugs are not available in India. These are not accessible to Indian populations. And therefore, there is a tremendous limitation of accessibility to this effective drug, despite the fact that these drugs has been proved to cure hepatitis C virus infection in almost all patients. Till the time in this country such effective drugs are available and accessible, patients with chronic hep C infection and needs therapy, and the Hcv infection as a whole needs control in this country because of its sinister sequelae, which we know already. So till that time, these agents are available and affordable and accessible to Indian people. Their practical use seems to be bleak. Affordability of people who are infected with it, accessibility to this drug, which is completely limited in this country, we need a different practical approach to treat our patient in this country. In India particularly, another important aspect of management medical management particularly is that the state funding or insurance cover is practically non-existent. 80% of the expenses are borne by the patient themselves. This assumes important because of exorbitant cost of recently recommended directly acting antiviral therapy in patients with chronic hepatitis C virus infection. That's the reason why Indian National Association of Study of Liver formed a task force in which 32 active hepatologists working throughout the country collated all information on hepatitis C virus infection from this country, analyzed them, structured them, discussed threadbare, and devised a practical management guideline for hepatitis C virus infection which will be relevant to this country. In this context, I must say our research came handy. I have particularly seen that even the standard of care treatment with pegylated interferon and ribavirin is afforded by quarter of our patients who are eligible for management or treatment. And therefore we used regular interferon with ribavirin, which are much cheaper than pegylated interferon and ribavirin, and actually documented that the viral cure or eradication of hepatitis C virus, which is expressed technically as sustained viral response or SVR, is similar with pegylated interferon and ribavirin. This guideline also includes such recommendations which are practical, which are cheap, and can be provided to a large segment of population, thereby increasing the treatment frequency of these chronically infected hepatitis C virus patients. The Indian National Association for Study of Liver guideline for management of chronic hepatitis C virus infection has used the standard of care therapy using pegylated interferon and ribavirin while waiting for availability of directly acting antiviral agent in this country. The INSL task force members are very much aware that this recommendation may change in the ensuing time, probably within a year, depending upon availability of directly acting antiviral therapy in this country and the results of their efficacy in the population which is prevalent in this country. I must say that the leadership in the Indian National Association for the Study of Liver, headed by Professor Vivek Saraswat, Professor S.P. Singh, has done a commendable job in organizing this task force and particularly evaluating the information or data that are available on hepatitis C virus infection status as well as therapy in the country. This is the first effort, and I will say very immensely valuable document on an infective disease which causes progressive liver damage and irreversible liver diseases like liver cancer and cirrhosis leading to high death rate. Despite the fact that these guidelines will change in future depending upon more availability of more effective therapy, this effort actually for the first time established the epidemiology of hepatitis C virus infection, the disease spectrum, the available management strategy, their efficacy, and the future problem which need to be cracked, particularly in this country, has become more clear and more objective. This helps clinicians, planners, administrators, policymakers in this country to design and effectively implement control of hepatitis C virus infection in this country. Thank you.